have
conference will now be recorded.
the type of letters that you might get on your OET and how to tailor your letter in terms of your audience. Okay. What we'll do in today's session is that instead of concentrating on the type of letter that we have, we'll concentrate on the special type of people who might appear on your OET writing, which is not the usual referrals that we've discussed before, because we've discussed surgical referrals before and we've discussed medical referrals before. Now we're going to be discussing a few non-medical people or the different types of nurses which might appear on your OET writing, and we'll try and tailor our content as well as our clarity depending upon the type of audience that we have. So let's just try and see. I hope everyone remembers the concept of content and clarity and how they are assessed on your OET writing. Guys, please type in yes if you've understood the concept of content and clarity. We've discussed it quite a lot in our previous sessions. So if you've understood that concept already, just type in yes. Otherwise, I'll try and explain it again just to make sure that everyone is on the same page. Okay. All right. So let me just quickly discuss it. So content basically means, so in your OET letter, you have three parts which are actually discussed. That's going to be your purpose, which is that you being able to tell the audience that you need to do this for this patient. That's your purpose. Content is the information that they need in order to do the purpose. So in order to do their job, what information is quite necessary and is a part of your case notes that you definitely need to include on your letter. Okay, so that's going to be your content. Your clarity is excluding information which is not important for that purpose. Okay, so the three pillars of your OET writing and case note selection are purpose, content, and your clarity. So in today's session, depending upon the type of referral or the type of person that you're writing the letter to, we'll try and figure out what would the purpose be, what would the content be, and what would the clarity or might be, or the what the examiners might put in the case notes which aren't really important. And if you include them, then you're going to lose marks for clarity. All right. Now, the first letter that does appear quite a lot on your OET is the referral to a physiotherapist. Okay. Lots of people during the last week asked me the difference between an occupational therapist and a physiotherapist, because when you're writing letters to a physiotherapist versus an occupational therapist, you need to be very clear of what they do, what their role is in your patient's care, and what would you need for your patient that you're writing a letter to a physiotherapist. Now, physiotherapists are people who are responsible for the movements or are responsible for the gross movements of a patient. Okay, so that means walking around the house, or if someone's not able to walk, do they need mobility aids? Like, do they need a walking stick or a walker? Or if someone's bed bound, do they need something to help transfer them from a bed to a chair? Okay, so all of that responsibility with regards to movement and exercise for a patient are going to be dealt with by the physiotherapist. Okay, now that we've understood that concept of what a physiotherapist does, on your OET letter, the main purpose that you might have to write a letter to a physiotherapist is when you want to discuss their mobility, or when you want to discuss their perhaps an example of a letter that you might get is that you might get someone who's had an injury, and they've been admitted to your hospital, and now they're getting sent home. But when they're home, you want the physiotherapist to see this patient so that they're able to monitor your patient's mobility in the community. They might be able to provide them with tips, or they might be able to actually help exercise this patient. So they might go to this patient's home. They might help them walk. They might provide them some walking aids, which they might need. So those are all of the purposes that you might get when you're writing a letter to a physiotherapist. Now, now that we've discussed what the physiotherapist does and what they may be asked to do on your OET letter, let's just discuss what information is quite important to be included in a letter to a physiotherapist. So that's going to be your content. So content will be information regarding whether this patient has had an injury, whether they, how are they walking right now? Are they using any mobility aids right now? Is this a change from their previous mobility? For example, if someone is usually quite independent, but they've now had an injury, or they've had a fracture, and now they're using a frame. Okay, so that's going to be a change in mobility from something to something. Now, if you were writing a letter to perhaps a cardiologist, they won't really be that concerned with the type of mobility aid that the patient is using. But remember, because the job of the physiotherapist is to deal with mobility, so every single detail regarding this patient's movement needs to be included as a part of your content. Guys, it's very, very important that we understand this concept for the OET, because the major part of grading you is whether you're able to decide on information which is important for your audience. You might have someone who's living in a two-storied apartment versus a one-story apartment. So that basically means that someone has to climb up stairs to go to their bedroom. Now, if your patient has had an injury or they've had a fracture, then for them to walk from their kitchen, which might be on the ground floor, and for them to go on to the top floor or to the second floor is going to be difficult, especially if they've now started using a walker. So your physiotherapist definitely needs to know about the home situation for a patient. If you were writing the letter to perhaps a psychologist or a psychiatrist, this would be irrelevant information. But for the physiotherapist, they are the relevant information. Social status. If someone lives alone or has recently divorced, or they've recently lost their partner, that's going to get important for the physiotherapist, because perhaps the partner could have helped them before with moving about the house, but now they've got no one at home. So if you were writing a letter to a, perhaps you were writing a letter to a cardiologist, they won't really need to know about all of this, about their marital status or whether or not they live alone. But definitely a physiotherapist needs to know this. Okay. Clarity. Clarity is the information that you don't want to include to a physiotherapist. So that's going to be any detailed medical information, any medication history. This patient is on metformin, gliclazide, aspirin. The physiotherapist doesn't want to do that because they're not really going to be dealing with this patient's medication. So if you include medication history, the OET is going to penalize you. Okay. So we're just trying to differentiate as to, depending upon who you're writing the letter to, you're tailoring your information. One information is going to be relevant for someone and the other might not be. So that's the concept of purpose, content, and clarity. Guys, remember that your physiotherapist is not someone who's strictly medically trained. So using layman terms can sometimes become important. If you're talking about very, very complicated diagnosis, the physiotherapist might have lots of trouble dealing with it. For example, if you talk about diagnosis like this patient has been diagnosed with glioblastoma multiforme, and that's it. You leave it at that. They might not understand what you're talking about. So you might have to write that this patient has been diagnosed or recently diagnosed with a brain tumor called glioblastoma multiforme so that they can understand what you're talking about. It's a little bit similar to the concept that I've tried to emphasize on in speaking. That you need to explain complicated medical terms. This might become important when you're writing letters to non-medical audience. So we'll touch upon a few more non-medical audience or non-doctor audience that you might get. But this is the first one that you might have to explain the difficult medical words for. Guys, if you've understood the concept of purpose, content, clarity, and layman terms for a physiotherapist, please type in yes and then we can move on. Excellent. Okay. So, guys, you do need to understand that these concepts, even though they might sound a little flippant, or a little bit too easy or simplistic for you right now. But when you go to your actual exam, if you don't understand these basic concepts, you're going to fail on your OET for no fault of yours. Okay, that's just how the OET works. They want you to fixate on selecting information, and even though this is not going to be checked by doctors, they have set standards set up. So you need to follow the set things that they've said, that you include this or exclude that. So make sure that you do that. All right, now we're going to move on to the second specialty. Now, before I show you that, I want to test the audience a little bit. Guys, if you understand what an occupational therapist is, please type in yes or just explain to me what you think an occupational therapist does, and then I'll give you my answer because a lot of students, they struggle with this concept. All right, so a very mixed bag of answers. Some people have said that they think that it's related to work. Some people have said that it might be speech therapy. And Ruhi has said that it helps patients to develop skills and improve and recovery. Manpreet has said that they might arrange support at home. And Lissy has said that occupational therapists help use of particular activities as an aid to regain physical from physical or mental health. Okay, all right, guys. Let me show you what the actual definition of occupational therapy is, as indicated from the Royal College of Occupational Therapy. So it says that an occupational therapist job role is to help people of all ages to overcome the effects of disability caused by illness, aging, and accident. An occupational therapist will consider all aspects of a patient's needs, including physical, psychological, social, and environmental. What that means is that the occupational therapist is basically someone who is going to be helping a patient regain their pre-morbid status. So when someone falls ill or when someone has an injury, then they might lose function. So for example, if there was someone, perhaps an elderly lady, she was about 70 years of age, but she was very, very well before getting admitted to the hospital. Okay, or before she fell ill and had to get admitted to the hospital. So if we've got someone who's come in with perhaps this lady's come in with having a fall at home, and unfortunately now she's sustained a subdural hematoma. Now because of the hematoma, she's unable to walk, and when she goes home, even though previously she was completely independent in her activities of daily living, now she's become, she won't be able to go home and cook and clean for herself. So she's going to need help with that. Okay. Or it could be that she might not be able to use the things like a commode properly or wash her hands in the sink now, because that's just a consequence of her illness. So before discharging this patient, we might get this patient seen by an occupational therapist who's basically going to be arranging a package of care for this patient. So they might help arrange carers for this patient, or they might arrange simple things at home. For example, a special type of commode that she can use now, or some things which might help her with cooking and maintaining her level of independence in terms of special types of spoons or special types of knives. Even if someone is, for example, they're suffering from a psychiatric illness or depression, and because of that they're not able to feed themselves or they're not able to have food because that's just a part of their illness, the occupational therapist might help support it at home. So basically, your activities of daily living, cooking, cleaning, shopping, taking a bath, maintaining cleanliness, maintaining hygiene, everything which we think is a part of our daily life, the occupational therapist will help the patient achieve what their goals are and maintain a normal or a new normal lifestyle for a patient. So Manpreet has asked, so they do a similar job compared to social workers. Now, a social worker, Manpreet, is a bit different from an occupational therapist. Occupational therapists basically are quite well trained in fine motor tasks. Okay, for example, things that you might feel they're not because you might not have noticed them before, but things like using the spoon, or if you can see in this picture, walking with a tray, holding a cup, using the commode, so sitting on the commode. When someone has a particular type of stroke, they might not be able to sit on the commode in the usual way. So fine tasks, using the brush, they're quite trained in that, and they have aids available which they might arrange for the patient, which they might use. This is especially important in people who've had strokes. A social worker, whereas, will be someone who can support only the social status for a patient. So they might arrange carers, they might go to the home of the patient and just have a chat with them, but they're not really trained as much as the occupational therapists are in terms of fine motor tasks. What I mean by support at home is what we call a package of care. So basically, if someone's quite elderly, they're not able to take care of themselves, or they're not able to take medications themselves, and they live alone and they've got no one who can help them with, is they sometimes arrange a package of care, or some person who will go into the house of this patient perhaps twice a day or once a day. When they go to the house, they might be able to administer medications for this patient. They might just be able to prepare a meal for this patient. They just might be able to walk the patient to the toilet. So that's what I meant by support at home. So Manpreet, if you've understood that concept of the difference in between a social worker and an occupational therapist, please type in yes, and then we'll move on to the OET aspects of it. Excellent. Now, let's just talk about how the occupational therapist might appear on your OET writing. So it might appear in a fashion that I've described right now, which could just be helping arrange a package of care for the patient. Or it just might be that sometimes what we do in hospitals is that we discharge patients, but then we arrange for the occupational therapist to go home and see this patient, see their home environment, and see what can be done in that home environment to help this patient. Example, you might have patients who might be hoarders. What that means is that sometimes they collect a lot of stuff in their house and they cram their house with a lot of things which they don't really dispose. The occupational therapist is then going to go into the patient's home, see what their home situation is like. Does this patient need a deep cleaning of this house because now he's not able to walk to his toilet? So everything will be done by the occupational therapist. So you can either get two scenarios in terms of purpose, which might be arranging a package of care or support at home. So that's going to be your purpose. The content. So what information you definitely need to include in a letter to an occupational therapist, that's very, very similar to the things that we need to include for a physiotherapist. They need to know, Ruhi, yes, they do need to know about the home environment in quite a lot of detail. So, when you're writing your OET letters, usually when people are highlighting their information, they tend to cut the home environment almost automatically, because medically for doctors, it might not be the most important information. But the occupational therapist definitely does need to know about what kind of house do they live in. Is it a house? Is it a flat? So is it a single story? Is it a multiple storied house? If the case notes mention where the toilet is, or where the bathroom is, where the toilet is, where the kitchen is, that's also going to be quite important for this patient. So the content is almost the same for an occupational therapist and a physiotherapist. Clarity is also almost the same. So detailed medical things aren't really important for the occupational therapist. So they don't want to know about this patient having diabetes for 35 years, or having this particular diagnosis of stroke or this particular type of bleeding on the surface of their brain. They don't want to know if they've had a 3 centimeter subdural or a 5 centimeter subdural hematoma, because they're not actually going to deal with this. They just need to do what they are supposed to do, or what their job is, what they specialize in. So detailed medical things aren't going to be included in a letter to a occupational therapist. Again, layman terms do need to be described a little bit. So guys, if you understood the difference between an occupational therapist and a physiotherapist, please type in yes. And if you've understood how we would tailor a letter to an occupational therapist versus a physiotherapist, please type in yes as well. Excellent. Now, those are the two big ones which do appear on your OET quite a lot, and people get very, very confused when these do appear. But now that you've had this session, it should help. Benita, if you have any question, please type into the chat window and I'm happy to answer it. All right. Now, another thing which does appear on your OET are the clinical nurses. Okay, so Benita, before we just move on, Benita has asked that she doesn't really understand clarity. So, Benita, what you need to understand is what this person's occupation is, or what's occupation is a bad word to use when you're describing an occupational therapist. We need to understand what this patient's job is, okay? So a physiotherapist's job is to help deal with your patient's movements, okay? So they're going to help the patient perhaps walk, okay? For them to do this job, they don't need to know about this patient having diabetes for 35 years, okay? That's not strictly related to their job. They do need to know what type of walking aid that they're using, whether they have any nerve problems in particular, which might be affecting their detail to walk. So, for an occupational therapist, for example, they're going to be arranging a package of care for this patient. So they're going to arrange support for your patient at home. So telling them that this patient had a upper respiratory tract infection today, not really very, very important. Telling this patient about the fact that they are on metformin and simvastatin, how is that going to contribute to their job or what they're supposed to do? So that's what I mean by detailed medical details. Okay, so Benita, if you've understood that, please type in yes, or otherwise I'll try and give some more examples. So Sujan, if you want to differentiate between physiotherapy and occupational therapy, physiotherapy is your major movements, okay? So walking, sitting, moving legs, moving arms, so big movements of arm, big movements of legs, moving around the house, walking, that's your physiotherapist job. Occupational therapist, fine movements, writing, cleaning, cooking, so the things that you use your hands, okay? Perhaps it can also be, if someone works in a job, it might be typing, because that's also a fine movement. So the occupational therapist helps to optimize fine movements for a patient. So and with the help of this, they're able to differentiate. Benita has asked what should be included in detailed medical details. Benita, what I mean by clarity is that this information does not need to be included in a letter to an occupational therapist or a physiotherapist. Okay. So clarity means the information you don't want to include for this patient. So you don't have to include the medical details. Okay, guys, this slide, the purpose means why you're writing a letter to this professional. Content means what information needs to be included. Clarity means what information needs to not be included. Okay, that's how I've tried to present these slides, because content and clarity are specific points that you're marked on your OET writing. If you see our previous sessions, we have discussed this in detail about the concept of content and clarity. So Benita, make sure that you understand this, because they're going to grade you on content and clarity. So make sure that you understand the difference. Okay. So Yaso has asked if they write that the patient is to walk 30 minutes a day, the occupational therapy can do it or not. So the occupational therapy does need to know about physiotherapy because they work in tandem. So you do have to mention that, Yaso. All right. Now, yeah, so if you've understood that, please type in yes, and then we'll move on to the clinical nurses which appear on your OET writing. All right, now we're going to be moving on to the clinical nurses. Now, you might get this concept of clinical nurses, which you might be a little unfamiliar with, especially if you work in an Eastern country, because this is basically some concepts which are in the UK, in the US, and in Australia, where the OET is based. So I might have to explain the concept of a clinical nurse first before we just move on to the purpose, content, and clarity. A clinical nurse is a nurse who's done a basic nursing degree, and on top of that, she's specialized in a very, very particular field of medicine. Some examples of clinical nurses are a diabetes specialist nurse. So she's just going to be dealing with diabetes, but they're very, very good. So they're able to manage the medications for your patients. They're able to modify the insulin dosages for your patient. They're able to help with wound dressing for a patient with diabetic foot. So they're very, very good. Or another type of a clinical nurse that you might get would be a cardiac rehab nurse. So that's someone who's done a nursing degree in which is the basic nursing degree, and on top of that, they've specialized just in cardiac rehab. So they're going to know a lot about cardiology, perhaps more than an undergraduate doctor would. And they're going to know a lot about things which help with rehab for a patient. So their two focuses will be cardiology and rehab. I have discussed this concept of clinical nurses before. If you go to our YouTube channel and if you search for surgical referrals and specialist nurse referrals, that has been explained in detail about the various types of nurses which can appear on your OET writing. What I want you to understand is that they have specialized in one particular disease or one particular field. Okay, so you need to understand that in your mind when you're writing a letter to this clinical nurse. The purpose is usually a referral for that particular disease. Okay, it's usually a referral letter rather than a transfer or a discharge letter. The content is going to be only things related to that disease. Okay, so the clinical nurse specializes, for example, in diabetes. You're only going to include information related to diabetes, and you will include that information in detail. You will mention this patient has had diabetes for 20 years. You will mention they are on insulin 4 units 3 times a day. You will mention they sometimes don't take their insulin. So every single thing about diabetes needs to be included in very, very good detail. Everything else is clarity that you're going to cut out. Any other disease, even sometimes OET might try to trip you up, okay? You might have medications not for diabetes in the patient's medication list. You do not include them when you're writing a letter to a clinical nurse. This might sound very counterintuitive to you or medically wrong, but that's something that they do assess on your OET, and this has been confirmed by official OET that when you're writing a letter to a specialist nurse, you will only include the medications of that particular disease. Okay. So, guys, if you've understood that concept as to what a clinical nurse does and how you tailor your letter to a clinical nurse, please type in yes, and then we can move on, because this is a very, very important concept to understand, because this is tested on your OET and this is often a failing point on the OET. So I want to emphasize that my students don't trip this up on their actual exam. Excellent. Now we're going to move on to the school nurses. So these do appear, they appear 1-2 times on the OET, and people, they lost their mind when they got this on their OET. So school nurses are basically nurses who provide a link between the school, home, and community. So they're basically based in a school, but they get students from that catchment area or from the students that they get from that particular area, and they help provide healthcare for this patient, for this child in the school. Okay. So the aim of setting up this practice of school nurses is to improve the health of children while they're at school. So you have a place that the child is going to go to every day. So um, it's a very, very useful place that you might be able to provide basic healthcare to the child in terms of immunizations, perhaps assessing them for recurrent infections, assessing them for family environment or minor injuries. It might be quite useful to have this person who is in the school, and the child is going to regularly see this person who's trained in nursing to help them out with their health. So if you've understood that concept of school nurses, please type in yes, and then we'll move on to purpose, content, and clarity. Oriade has asked, what if in a situation a patient has an infection that might affect diabetes control? If you're thinking that much, then you're probably wrong. Okay, that's the clue that I used for my students when they're preparing for their OET. That if you have to use very, very advanced, not even advanced, if you have to use medical knowledge to solve the letter, you might be writing too much. So yes, sometimes infections can affect diabetes control, or particular medications can affect diabetes control, but the OET is not a medical exam. They won't really test you on knowing the diseases which might affect diabetes control or medications that might affect diabetes control. If you're still confused, Oriade, and medically you think that I must include this and it's creating a lot of anxiety in your mind, then you might write that this patient has been started on prednisolone, or perhaps they were started on some kind of a steroid. This patient has been started on prednisolone for 5 days, which might affect his diabetes control. So do mention that. Make sure that the OET knows that there is a reason that you've mentioned this, because you think that it's a part of content. If you don't explain it, then they might just cut your marks, because remember, they're not medically trained. Riso, this is applicable to both doctors and nurses, don't worry. So Nima, I'm just going to go through what the content and clarity should be for Nima and Nitish. I'm just going to go through what the content and clarity is for a school nurse. Okay. Now, the purpose of letters when you're writing to a school nurse can be supporting a child's discharge. Perhaps the child has been admitted in the hospital for a short period of time and now they need follow-up in the school. For example, they've been admitted with an exacerbation of asthma, and which is a new diagnosis, and you want the school nurse to perhaps do a peak flow for the patient. Okay, this can either be a referral letter, for example, a new diagnosis the school nurse is going to see the first time, or a discharge letter that the school nurse already knows this patient for a long period of time and you're doing modifications in this patient's care. So that's when it's going to be a discharge letter. Ruhi and Nima, you need to figure out whether whether your audience already knows this patient or not. Okay, for any type of letter that you're writing on OET, a very, very, very important point that you have to ask yourself before writing the letter is that whether your audience knows this patient already. If they know the patient, then you don't need to include the past medical history for the patient. You definitely need to include the new changes which have been done, but the past history they already know. So doing that will go on to your clarity. So past history, if they know the patient, goes into clarity. So Ruhi, if the specialty nurse is going to see your patient for the first time, for example, the diabetes nurse is going to see your patient for the first time, you're going to tell them each and everything about the past history of the patient's diabetes. Okay. So Manpreet has asked, if a patient is due for transfer first time in care home from hospital, do we need to add all the medication with dose? If they're going to a home, you do need to mention their medications and dosages, because remember, there is a reason that this patient is going to a care home, because they're not able to take their medications themselves. So the care home needs to know that you are to give this patient this medication, this medication, this medication. This medication you give 1 tablet, that medication you give 3 tablets, this injection you have to give 1 injection. Okay, Manpreet, do you understand that concept, how they're involved in the care of your patient and what they need to do? This patient is going home, or they're going to their new home now. They're going to have to definitely take those medications at home. The patient can't take the medications themselves. So it's your responsibility to continue the care for this patient by telling the care home that please do these things for my patient. So Manpreet, if you've understood that, please type in yes. Tabuya has said, will this for clinical nurses, do they specialize? Do they specify which specialty, or you need to guess? Tabuya, they will definitely tell you about this specialty. So the letter will be written as, write a letter to a diabetes specialist nurse, write a letter to the cancer nurse, write a letter to the palliative care nurse. Tabuya, if you want to know about the different types of clinical nurses which might appear on your OET, just go to our YouTube channel and just look for the video which says surgical referrals and specialist nurses. I have highlighted all the different types of specialities of nurses which can appear on your OET writing as well as speaking sometimes. Okay, excellent. Let's move on to a psychologist. Guys, if you already know the difference between psychologist and psychiatrist, please type in yes. So there are 2 types of professionals which deal with the mental health of patients. They're going to be your psychiatrist and psychologist. All right. So let me just emphasize the concept for people who might need a little bit of revision. Psychologists are people who focus on psychotherapy and behavioral therapy. Okay. While psychiatrists are doctors, medically trained, who do deal with with mental health, but they're able to prescribe medications. Okay. That's the main difference that you need to understand, especially for your OET writing when you're writing a letter to a psychologist. Okay. So psychiatrists are going to be focusing on medications, medication management, and course of treatment. Psychologists are going to focus on psychotherapy and cognitive behavioral therapy. But both these professionals are going to need to know every single thing about the mental health of this patient. Okay. So the focus is the same, or the job is the same, the means to do that job is going to differ. One is going to use therapies, the other one is going to use medication. So just understand that concept. Guys, if you've understood that, please type in yes, because it's a very, very important concept that you need to understand before we can move on to the content and clarity, because this will come in. Rezo has asked about not sounding like a native English writer. So, Rezo, what I've done for people who aren't native English writers, I've tried to make a cheat sheet with very good sentences that you can use and sound like a native English writer. So if you just go to our YouTube channel and you type in cheat sheet on our YouTube channel, you'll be able to see several phrases that I've given, which you can use in terms of your introduction,
Your
conclusion, and the
introduction,
paragraph.
conclusion, and the paragraph.
So if you use that, you should be able to solve a lot of problems in terms of your OET writing and not sounding like a native speaker or a native writer. Okay. All right. So, Rezo, you should type in cheat sheet. So like cheating. So cheat sheet on our YouTube channel, you should be able to find a lot of phrases that you can make notes for. So the channel is Teach Your Academy and it's cheat sheet. So you'll have phrases for writing as well as speaking. They might help you quite a lot. Okay. Excellent. Let's just talk about what the purpose might be on your OET writing for a psychologist. The usual type of letters which appear for a psychologist that you have to write might be someone who's been admitted in your hospital for a long period of time with mental health issues, or you've been seeing them in clinic as a GP and you want to refer them for a cognitive behavioral therapy session or psychological counseling. So it's usually a referral letter asking for your patient to get some counseling or some cognitive behavioral therapy. In order for the psychologist to do that job, the information that you need to include in your letter will be everything related to the mental health issues for this patient. Have they come in with a particular visit when they were anxious, depressed, low mood, tearful, crying? You need to mention everything. Have they ever been admitted to the hospital with a history of mental health issues? You need to mention that. Have they started to leave your practice or they've started to not engage in treatment because of their mental health issues? Very, very important to mention everything related to the patient's mental health. A lot of people, they confuse this sometimes. you sometimes get multiple visits in such kind of patients. Okay, so you might have a letter where you're seeing this patient regularly in clinic as a GP. Some visits are when the patient came to you with perhaps an infection, perhaps a fever, perhaps for a medication prescription. So those visits aren't to be included. You do need to include the visits when the patient came to you with anxiety, with depression, with low mood, or any mental health issue. If in one visit they came to you with an infection, but they looked very, very anxious to you, you need to mention that visit as well. But when you're mentioning that visit, you will emphasize that when this patient came to me on the 29th of June, 2019, related to a respiratory tract infection, she appeared extremely anxious and tearful. So you need to emphasize on the visits when the patient came with mental health problems or displayed mental health problems. Social history is very important for a psychologist. Are they recently divorced? Have they recently lost a partner? Do they live alone now? Have they lost a job? Are they struggling with money? These things do affect a patient's mental health, so you do need to include them. But something that I sometimes try to emphasize again and again, which people do mess up on, is drug and alcohol issues. If a patient has a normal alcohol habit, that might not be very, very important for a psychologist. But if they drink heavily, that's going to become an issue, and that's what you have to mention. Okay. If they've got uh, any drug issues, or they're using some medications over the counter as recreational drugs, those become very, very important for a psychologist to know. Remember, a psychologist is not going to prescribe your patient any medications. They don't need to know the detailed medical history about the patient having diabetes for 25 years or hypertension for 10 years and being on simvastatin as well as candesartan and some insulin, because they're definitely not going to be prescribing any medications to your patient. They don't need to know about every single minor illness that the patient had. For example, if they had cold 2 years ago, the psychologist is not going, that's not going to contribute to a letter to a psychologist. So the things you need to include for a psychologist are going to be mental health history, anything which can affect their mental health history, and anything which might affect the psychologist managing this patient. If you've understood that, please type in yes. Excellent. Moving on to the last slide, or the last difficult referral that we do today, and that's going to be a district nurse. This is a bit different from a specialist nurse, because a specialist nurse is going to specialize in a particular disease. A district nurse or a community nurse is someone who goes to a patient's home to provide them with one particular thing. Okay, so they're not going to be sitting with the patient throughout the day. They're going to go into the patient's home and do one particular thing, which might be giving them particular medications. Insulin is quite important, and it does appear on your exam quite a lot, about a patient getting discharged from your hospital and them needing insulin at home, which you want the district nurse to do. So they might also sometimes give you questions where you have to, the district nurse has to do wound dressing at home. So the patients come in with diabetes, and you found them to have a chronic ulcer, which you want the district nurse to go and manage at home every day. Or this patient has been diagnosed with an infection, a severe infection, but you want to send them home yet they need to complete the course of their IV medication. So you have to mention that when you're writing a letter to a district nurse. Now, if you've understood the concept of district nurse, guys, please type in yes. Otherwise, I'll try and explain it in detail. Okay, very, very good. So the purpose of your letter, when you're writing a letter to a district nurse, is to arrange visits for the patient and arrange insulin administration or IV drugs or medications at home for your patient, along with sometimes wound management for your patient. So the district nurse is only going to go into the house and manage that wound. So what does she need to know is the history of illness related to the wound. You can say that this patient has, so they might want to know about uncontrolled diabetes because that's going to affect the wound healing. So this patient has a history of uncontrolled diabetes, which has created a very large ulcer on the back of his foot. You have to mention, if you're referring this patient for a wound dressing, they need to know every single thing about that wound. They need to know about the color of the wound, the depth of the wound, the size of the wound, the treatments which have been given, whether there's pus coming out of it, because they're going to be monitoring the wound in the community. So they need to have a clear picture of what the baseline wound is. So make sure that you mention that. If the district nurse is going in to give this patient insulin, then you do need to mention a little bit about the diabetes history of the patient and the dosages of insulin and the type of insulin that you want them to administer. Very, very detailed social and medical history unrelated to the disease that they're managing is going to be excluded, and it will be a part of your clarity. So telling them about hypertension, upper respiratory tract infections, and things which they aren't really going to deal with are going to be wrong. Okay, so guys, if you've understood that, please type in yes. Excellent. Very, very interactive and very fast and intelligent audience today. Okay, now those were the type of difficult referrals which might appear on your OET writing. If in your exam you had some type of specialist which you weren't aware of, I'm happy if you text us on the number provided, because we'll try and do another session on OET writing next Saturday, and I'll try and cover those particular specialities. User, if you want to know more about specialist nurses, I've covered only specialist nurses in a detailed lecture. So if you go to our YouTube channel and you type in Teacher Academy and search for surgical and specialist nurses, I've explained it in quite a lot of detail. So guys, please make sure that you visit our channel, Teacher Academy on YouTube, and do subscribe. You can visit our website www.teacheracademy.com for our writing check, speaking check, as well as to get in touch regarding the webinars that we're giving. Taboya, we're going to be discussing speaking as well, so stay tuned. And while you're waiting for our future live webinars, please go to our YouTube channel. We've got lots of sessions on speaking. So that was the session for today. I hope, guys, you had fun. You learned something new, and you're going to carry all of that knowledge to your actual OET. And everyone's going to do very, very well on their OET writing, and they're going to score very good marks. And when you score good marks, please remember this session. And I hope you guys are keeping safe and you're well. Just keep practicing, just keep studying, and don't concentrate on what's happening around the world. Just concentrate on your goals, and you should be very, very successful. Good luck, everyone, and stay safe.